Thank you so much for joining us today, Lisa. It's great to have you, and thank you for talking about coronavirus, which obviously we're getting a lot of questions on at the moment. And I think the question that I've had the most over the last couple of weeks is, are people with endometriosis more at risk?
The simple answer is no. However, there are a few more things to be said about that. Coronavirus is a virus, and we all had other viruses in the past, and it's quite clear that when we feel tired, run down, when we don't exercise, don't sleep, we are more susceptible. So I would like to turn the question around to spend a bit of time to think how we can optimize our health to make ourselves more resilient not to catch the virus. And we are all aware of the guidance of staying in our houses as much as possible, but I would also like to stress the importance of regular exercise to make oneself more resilient and also as a way of dealing with pain. I would also like to stress the importance of a good diet, and we can go into a little bit more detail, and the importance of sleep. We are, from research, we know that people with endometriosis have a little gap in one part of their immune system that is linked to clearing endometriosis cells out of their bodies. But we don't think that this gap in the immune system is at all relevant to the response, the body's response to coronavirus. A small group of women with endometriosis have endometriosis of the chest and might be worried because coronavirus is also a chest disease. So these women should heed the advice, the government's advice, and wash hands frequently and only go out for exercise and for getting food.
So is endometriosis not classed as an autoimmune disease? Because I know a lot of people that do have autoimmune diseases are classified as high risk.
Yes, it is not classed as the type of autoimmune system where your immune system is so weakened that you would be extremely susceptible to the virus. Let's say it's not at all like someone who is immunosuppressed for organ transplantation or is undergoing chemotherapy. So the immunosuppression in endometriosis only affects a small part of the immune system and doesn't make women with endometriosis a high-risk group.
Okay, thank you so much for confirming that. And we've had a few messages from people that are key workers and they're struggling, especially at the moment, both with their endometriosis and obviously still having to go to work every day. Do you have any advice for those people in that situation in terms of how they can manage at this very difficult and busy time for their work?
Good levels of exercise, sufficient sleep, a good diet, and self-care are the cornerstone of self-management of a chronic disease, whether there is corona or not. But in these times when perhaps secondary and primary care is not as accessible, that plays an even larger role. And the next step would be looking at the first level of painkillers are over-the-counter painkillers from the ibuprofen and paracetamol family. And then in the second tier involves taking those, and in addition to that, a weak opioid such as codeine or tramadol. So, of course, in a chronic disease, we wouldn't encourage very strong reliance and over-reliance on opioids. But for situations when the there's breakthrough pain, they might play an important role. So it might be a good idea to just stock up on sufficient painkillers, but also not forget the simple non-medical types of pain relief, which include the TENS unit, a hot water bottle, a hot bath. Being a key worker myself, I think it is really important to make most of your break times and also of your time at home. So if you can have a relaxing shower or a relaxing bath and make a ritual of that, that can be very valuable. Obviously, with endometriosis pain, there's also a role in using hormones to suppress cycles, and that could be the contraceptive pill, which was probably the one that is easiest accessible. And GPs are still open. We now GPs run phone consultations, and with suspected or confirmed endometriosis, it might be possible to get a pill prescription over the phone.
Mm-hmm. Thank you. No, that's really, really helpful. And in terms of the impact that this virus is going to have on endometriosis care generally, would you mind just perhaps giving a bit of an overview of what it's looking like for people with endometriosis at the moment?
Yes, the GPs have now largely switched to telephone consultations, and obviously they're very busy with looking after people with corona, but your GP is still your first port of call for endometriosis related issues. And if you've already been referred to the hospital doctors would love to look after you, but at the moment, in the same way as you are locked down at home, we're also locked down in the hospital, which means that a big part of the hospital work is in lockdown, and a lot of the focus is on different areas. So just to explain that endometriosis is usually been looked after by gynecologists, and we have government guidance to put the planned gynecology work that involves gynae outpatient clinics and operating theatres on hold, and the gynecologists are either redeployed into helping on the labour ward or helping in the emergency departments and looking after sick patients with corona. So at the moment there is a very limited input that we can do. So doing this podcast is a little contribution to reach out to women who suffer from endometriosis in the community. The GPs can still contact gynae specialists in the hospital with questions, and we strive to answer questions. And what will happen with the planned surgery? If you've been listed for surgery, your surgery will be delayed, and the delay will be consisting of the lockdown time, where the hospital work is focused on COVID, plus a little bit of extra time where the hospital needs to catch up on surgeries for women who have cancer, because a big part of the cancer surgery is also delayed. However, if there are emergencies, the hospital is still operational. We still have our emergency department, and we still have gynecologists who can come and help you.
Thank you for that. And we had quite a few questions come in about the menopause injections. Do you know what the specific situation is for women that were having regular appointments to have those administered?
Yes, the menopause injections, they're different names, and one common brand that is being used is called Zoladex, and that can be either given in a monthly or a 3-monthly dose. In the first week, when our hospital was still had more flexibility to see women, we were able to switch some women from the monthly to the 3-monthly, but now it becomes obvious that even a travel to the hospital would expose us to catching or spreading COVID. And we've now phoned a number of GPs, and GPs have agreed to give the injection in their practice. But there is also another interesting possibility, a medication from the same family as the menopause injection can be given as a nasal spray, and this is often used in the fertility setting. Their GP, in conjunction with the hospital doctor, may be able to switch the injection to the nasal spray, and that would still suppress periods. Now, if you look into the sort of the doctor's Bible on medication, which we call the BNF, or the British National Formulary, this book states that this menopause injection should only be given for 6 months, because after that time there's concern about loss of bone density, what we call a brittle bone disease. And after that time, we can still prescribe it after an in-depth discussion with the client. This use after 6 months is called off-license use. This is something that, from a legal point of view, needs to be documented in the notes. So it's basically asking you as a client for permission to give that medication longer than it was designed for. Oftentimes, to make the risk of loss of bone density smaller, hormone replacement treatments such as tibolone pills are given, and they're also very, very helpful to suppress the hot flushes. So that is something that GPs may be able to do, but they may also want to contact the hospital gynecologist to get some additional guidance, because it is not something that GPs were used to doing prior to the corona crisis.
And for women that can't access that through their GP, what advice do you have to those women that aren't able to access the routine treatment that they would normally be receiving?
The first question is, was this treatment really helpful? Were you better with the injections? Because if the answer is no, then there's little value in just carrying on or striving to get something that's difficult to get. But if it was valuable, then you could look at other methods of suppressing ovulation. So what these menopause injections do is basically they put the ovaries to sleep, so they don't release an egg on a monthly basis, and that is why we don't see periods, and thankfully often we also don't see period pain. There are a number of other methods that are gentler on the system and easier accessible, and the easiest one would be to think using the contraceptive pill. And it could even be used in a special pattern whereby 3 pill packets are being completed without a break in between, which means that with a bit of luck, the menstrual cycle is put to sleep for 3 full months. So this is something that the GP might be able to prescribe. There are a few little boxes that need to be ticked. If you are starting new on a pill, a blood pressure check needs to be done prior to starting, and also after a few weeks of taking the pill. And the other thing is, this type of treatment wouldn't be suitable for people who suffer from genuine migraines.
Okay, thank you. Thank you for explaining that. And we touched on earlier a little bit about surgery and how most or all endometriosis surgery has now been cancelled. Obviously, for people that were awaiting surgery, that's obviously really disappointing for them and might have a big impact on their mental health. Do you have any advice for those people that
Yes.
have had surgery cancelled, and any kind of tips that you've got around people's mental
Mm,
health, how they can look after
yes.
their mental
Yeah.
well-being during this time?
First of all, I think I speak for many endometriosis specialists when I say that we really feel for you. It's not that you've sort of fallen down the back of our to-do list. We really, really want to do your surgery. I try to explain a little bit about how the gynecologists now save lives on the labor ward and look after sick women who are pregnant and have COVID at the same time with breathing problems. So that's the reason why as many of the operating theatres are also being used to as places where corona patients are being looked after. When it comes to keyhole surgery, there is the possibility that when the gas is put in the tummy, when the gas is released at the end of surgery, that a vapor is being created and infecting the theatre staff with coronavirus, especially when there's bowel endometriosis. So our professional body has said people with bowel endometriosis should certainly also not been operated on, not only because of the logistics, but also because of safety. And from a surgeon's point of view, I had to do emergency keyhole surgery on someone with a different condition, and operating in full PPE is very, very challenging. And endometriosis surgery takes a lot of concentration and focus, and doing that in the normal setting without PPE, I think would do the endometriosis surgery much more justice, and I believe the results could be also much improved, because much of the endometriosis surgery, when it comes to advanced endometriosis, is really microsurgery, and it's very important that the surgeons are familiar with all the instruments and can communicate well, because sometimes bowel surgeons are involved, and with these masks communication is possible, but is much more difficult. So I believe that is also safer both for the staff and the women with endometriosis to have surgery in a time when COVID is not looming over us.
Yeah, no, thank you. And obviously the NHS is incredibly strained at the moment, and thank you so much for what you're doing. You and your colleagues are doing an amazing job in circumstances that nobody's ever really experienced before. So no, it is completely understandable. And in terms of kind of logistics, I guess, for women that were awaiting surgery, so for women that did have a date booked for their surgery, what will happen once COVID is over? Will they get a letter, or what can they expect from the rebooking of that surgery?
Yes, what we are doing more and more now is whenever possible, we communicate through tele appointments. So there was a time a few weeks ago before we went into a full reorganization of our logistics that I was able to do telephone appointments, and I've also been in contact with some endometriosis patients who were waiting for results, and people said that was a really good and a convenient way of communicating with your clinician. So it is possible that your next appointment will be a telephone appointment. And I just want people to be aware that when we always talk about prioritizing, women in childbirth or women who have COVID or any patients who have COVID, it doesn't mean that we don't know and we don't validate that you are in a really challenging situation and that you might be suffering pain at home, and you might have been focused on getting your operation at that particular time and it is not going ahead. And we doctors are fully aware that this is a really difficult situation and we validate that.
Thank you. And we had a question from someone that that said that they suffer from chronic fatigue that was actually managed by their menopause injections, that they now aren't able to get through their GP. Do you have any tips for people that are managing fatigue as well as their endometriosis?
Well, first of all, if the injection that suppressed the menstrual cycle was useful, this using the pill with the 3 packets might be also very valuable. If that person can tolerate the pill and doesn't get bad side effects from that, that might be an interesting option. And the other thing for chronic fatigue, it sounds a little bit contradictory, but one way of making chronic fatigue better is to exercise, and that is exercise in baby steps. So use the time permitted to leave the house for exercise to perhaps do a walk for the first week, and then the second week to make that walk a little bit more powered, and then the third week to listen to a music music with a fast beat, so you walk a little faster. So over the time that we have now, gradually introduce exercise, and there are many yoga classes going on through Zoom or GoTo, where you can just tap in, and very important is these self-management techniques, build them into your daily life. For instance, mark out 3 times a week when you want to commit some time to looking after your mental and physical well-being, either by a power walk or a yoga class, and these things can have a very important impact. And now in this strange lockdown time, some of us have more time on their hands and can really utilize that opportunity to establish a good habit.
Yeah, no, definitely. And the NHS have got on their website as well, managing your mental health in the middle of COVID-19, and there's 10 top tips on there, and I definitely recommend people looking at those as well. They're really helpful, and there's an app as well that people can download in terms of walking, yoga, and so on. So I'll put a link underneath this video, so people can get hold of that as well. And you mentioned the contraceptive pill and also surgery, but what about people that were either awaiting to have a coil inserted, or people that are waiting for the removal of their coil? Do you have any information on that in terms of whether that can those things can still go ahead?
It is still possible to have coils changed if you make contact with your local family planning centre.
Mm-hmm.
Failing this, the coil that I think you were talking about Faye is probably the coil that is coated with this hormone progesterone. So the brand name is Marina Levocert. This medication could also be added on as a tablet to make that coil, the benefits of that coil, last a little bit longer. So when it comes to using the coil for pain, and you feel that the coil is coming to the end of its useful life, it is possible to add a hormone from that same family, such as the progesterone only pill, or so-called mini pill, onto that coil to extend the life of the coil.
Okay, thank you. No, that's really, really helpful. Another question here, I know we've touched on this a couple of times, but just to ask the question specifically, it says here, I've really been struggling with my mental health, especially now I've had my surgery cancelled. What do you recommend that I can do?
I think one thing that many people tell me was helpful, and what I also found helpful in chronic pain and its effect on emotional health, is don't bottle feelings up and just sort of isolate yourself with your feelings, but find a buddy, find people you can connect with, not necessarily only talking about mental health, but talking about other things. Expose yourself to daylight, coming back to trying to establish some kind of routine in your daily life, such as exercise, using mindfulness meditation or learning mindfulness meditation, which can be done through smartphone apps, might be useful. And then there's also CBT available, where your practitioner has an online communication with you. So all these things are still there. And I think we must not forget to look after ourselves rather than beating ourselves up in difficult times. So be kind to yourself and look after yourself.
Yeah, no, definitely. And it's worth saying as well, I think that, connecting with other people in a similar situation to you might be helpful as well. So if you've had your surgery cancelled, you definitely won't be alone in dealing with that. And Endometriosis UK's online forum Health Unlocked is still open, as is our helpline, and more of our groups are now also running groups online. So those groups that would normally meet up in person are now doing online groups. So do check out our website and connect with other people in a similar situation, because realizing that you're not alone as well might be helpful. As well. So thanks for that, Lisa. And next we had a question from someone that hasn't actually had a diagnosis for endometriosis yet, and they haven't been to the doctor about their symptoms, and they're struggling with pain, especially without a condition to give a name to. Do you have any recommendations for how they can help themselves at this time?
Yes, for situations like that where we have a suspicion but we don't have a full confirmation, we can label this suspected endometriosis for now. So that would be this condition that shows itself in severe period pain, painful sex, sometimes pain on opening bowels, fatigue, and the treatment for that would depend on what aspect of these things is the worst. So if much of the pain is centered around the period time, which is sort of obvious when you note down in a diary your pain days, and if it's all clustered around period time, simply suppressing the period with the contraceptive pill. As I said, it could be used even in that 3 months on without a break, then having a 7-day pill break, and then continuing for another 3 months. That could give relief, even without having the full diagnosis. If the pain mainly shows itself in bloating, some dietary changes might be valuable, and I think that there's another session that we're going to dedicate to that topic.
Thank you for that. And one thing that we haven't touched upon today is fertility. Do you have any information around what's happening with fertility services, any specific help that people might be able to get if they are having to have their fertility treatment on hold? And obviously that's an incredibly difficult circumstance for women to find themselves in, and perhaps do you know where people could get advice and support with that specifically?
Absolutely. The NHS guidance says that at the moment fertility treatment is not done, and many people might not want to fall pregnant in a time with so much uncertainty, but if the time feels right, it is still possible to fall pregnant with endometriosis, provided the fallopian tubes are open. So oftentimes we don't have a completely black and white situation, and sometimes it is possible to fall pregnant with endometriosis even whilst you're on the waiting list for fertility treatment. Again, when fertility treatment recommences is not clear at the moment, because we don't have information about when our lockdown and when our NHS will be organised in the more usual way. So unfortunately, I can't give you an answer regarding the time frame. But if you are waiting for fertility treatment, you can use the lockdown time to optimize your health. And in some cases, it might mean shifting a few kilos to get your body mass index into the green zone, which is associated with a better fertility outcome.
Thank you so much for going into that. That brings us to the ends of all the questions. Thank you so much for joining us today. I know it's an incredibly busy time for you right now, so we really appreciate your time and coming to talk to us. And I know a lot of people listening will have found that really, really helpful in terms of how they can help themselves at this time, as well as what's going to happen to their care. So thank you so much, Liza.
Yeah, and you're more than welcome. And I think I'm speaking for many endometriosis specialists who in this difficult time would like to do more for you, but we will do in the future.
Yeah, thank you so much.